Father Dr. Jacek Norkowski with us. We have also some audience in the room offline, quite a number of experts who are permanent members to or standing members to our parliamentary group, Justyna Socha, Anna Kubala, Dr. Janusz Korfel. We have with us Piotr Heszen, who represents the political committee of the Confederation of the Polish Crown, Agnieszka Fedel, Teresa Pracownik is with us, as well as a number of people who are watching us online, who are watching us on social media, but also I'd like to welcome Member of Parliament Włodzimierz Skalik right next to me. My name is Roman Fritz, and I'm the chairperson for this particular team. So, today, our topic, well, we also have with us Oskar Kochman. I forgot to mention his name. I haven't noticed you, sir. Apologize for that. So, today's topic is presumed consent in organ donation as a legal category, as a legal concept. And we will try to evaluate it from the point of view of both law and regulations, as well as medical facts. Do we have Grzegorz Braun, Member of Parliament? Have you joined us online? Member of Parliament, MP Braun, maybe would like to take the floor first because he would have to leave us. He won't be able to wait till the end of our meeting. If he's not with us, then we'll try and connect with him later. So let me set out our agenda. I propose that we should have experts from other countries speaking. They are absolutely renowned specialists, medical experts, physicians, doctors. So I would like our international guests to first speak, and then we'll have time for a brief discussion and hopefully a summary. Let me give you a little bit of context to you. We are preparing a draft law. We, as members of parliament from the Konfederacja political party, Confederation of the Polish Crown, that's the name of our party, and we're working on a law on organ donation after death. In Poland, presumed consent is the status quo, and our draft law is about to change this, change the presumed consent, so that cells or organs cannot be harvested based on presumed consent. Because according to our draft law, harvesting organs could only happen after consent. Currently, there's many people who have no idea that if unless while alive they gave consent, still their organs can be donated without their consent, because presumed consent is our status quo in our legal framework. So our objective is to raise awareness among the Polish people, or maybe members of other societies, about brain death, about organ harvesting, organ transplantation, and the notion of presumed consent. So now I would like to give the floor to our first wonderful guest, namely Dr. Paul Byrne. If you're with us, please speak. You have several minutes for your presentation, your speech. Over to you.
Okay. Hello, this is Dr. Paul Byrne.
Yes. Okay.
We can confirm that we can hear you, doctor. You can speak right now. The floor is yours. Dr. Byrne, the floor is yours.
Well, you can continue.
can continue.
Teraz słyszymy, tak?
We can hear you, Dr. Byrne. You can begin.
We can hear you.
English. So I don't know what you have been saying up until now.
Jeżeli jest jakiś...
Understand that this conference revolves around consent and presumed consent to get organ transplantation. Presumed consent is really no consent. To have consent, there has to be full and complete information about the donor and about the recipient. For organs to be transplanted, they must have circulation to the organ and circulation with respiration, because without this, organs are quickly damaged so that they are not suitable for transplantation. During life, the life is in the cells, tissues, and organs. There is structure of cells, tissues, and organs, and interdependence of cells, tissues, and organs that are interdependent according to function. When someone is declared brain dead, this is based on an absence of functioning or functions. That is not sufficient for death. When life leaves the cell is destroyed. It's called autolysis, pronounced autolysis, and that autolysis begins when the life leaves. It occurs quickly. It's manifest under the microscope as necrosis when it involves cells or tissues. We're used to that. It's an extenuation of that so far as the manifestation of death is concerned, but it's manifest because the life leaves. As long as the life is there, there is a chance for functioning. When the life leaves, the functioning stops, but it stops because the structure is no longer there. It stops because the autolysis, decay, and decomposition has altered the cells so that they are so damaged and not suitable for transplantation. For someone to consent for organ transplantation, that donor must be made aware of that. It is not made aware of that in the United States at the License Bureau, and I suspect not very many places. The recipient of the organ has, in order to give consent to gift the organ, must know that that organ, for it to be not damaged, must come from a living person. This kind of information is necessary to have consent for either the donor or the donor and the recipient. Other than that, consent is really no consent, and this is important for everyone to know. What ought to happen is no one ought to be declared dead based on an absence of function, or functions. There has to be more than that, and it has to involve destruction. The destruction begins quite quickly. It's called autolysis. Destruction of cells is not sufficient in itself for death. Likewise, destruction of cells, tissues, or even an organ. It can be an important organ, but death involves destruction and no one ought to be declared dead unless there is destruction at a minimum of the three vital systems, the circulatory and respiratory systems, and the entire brain. I hope this helps. Presumed consent is no consent.
Bardzo dziękuję.
Thank you so much, doctor. Thank you, doctor. Dr. Paul Byrne, who is an experienced neonatal expert, a professor in pediatrics from Toledo. So now I would like to ask Professor Coimbra from Brazil, because Professor Coimbra prepared some materials that have been already sent to you as members of our meeting, participants of our meeting. He talks about brain death, and that used to be called irreversible coma. So there was a change in terminology from irreversible coma to brain death. So let's talk about this change, and Professor Coimbra will shed light on what it means. Professor Coimbra, over to you. And maybe you can also comment on what the speaker before you, Professor Byrne, said. Professor Coimbra from the Federal University of Sao Paulo in Brazil. Professor Cicero Coimbra, please, the floor is yours.
Okay. So as you said, my name is Cicero Gali Coimbra. I'm Associate Professor of Neurology and Neuroscience, Federal University of São Paulo, Brazil. And first of all, thank you for this opportunity to speak to Polish Parliament. What we currently call brain death was formerly known as irreversible coma. Changing the name to brain death has posed a huge obstacle to the development of novel and more effective therapeutic measures to avoid the worsening of patients' neurological state. Medical science is always intrinsically attempting to overcome diseases and conditions previously considered to be irreversible, so that more novel and more effective therapeutic approaches become available to patients. But no one would provide or try to develop novel treatments to a patient labeled as dead. The following remarks describe events that were unknown by the time irreversible coma turned into brain death, and blocked any efforts to develop or provide novel and more effective treatments to patients in deep coma secondary to transient ischemia or head trauma. A victim of head trauma or global ischemia caused by cardiac arrest develops brain swelling. That means that the brain volume increases within the intracranial space. The cranial vault that protects the brain is a rigid, bony structure and cannot expand to accommodate the swelling brain. Consequently, the pressure within the intracranial space progressively increases. The result is a progressive compression of brain blood vessels and a progressive decrease in brain circulation. As brain circulation decreases, the brain's neurological and endocrine functions gradually become impaired. This means that neurological functions such as consciousness and respiratory drive gradually diminish, and the brain control and the brain control of thyroid hormone production also gradually becomes impaired. At this point, an issue arises that is critical for the recovery of the patient in coma. The decrease in thyroid hormone production further impairs the function of brain respiratory centers and increases brain swelling, thereby creating a vicious cycle that could be interrupted by administering thyroid hormones. However, this save-life therapeutic intervention is never done, and the vicious cycle continues. At some point, when the blood supply to the brain reaches less than 50% of normal levels, all detectable brain functions, including the control of respiration, stop due to reduced cellular energy production. However, at this point, the brain tissue is still viable, alive, as the residual energy production is sufficient to sustain vital cellular functions. This condition is called global ischemic penumbra, from which the patient could recover if normal brain is normalized. Upon replacement of thyroid hormones, brain swelling would diminish, intracranial pressure and compression of brain blood vessels would decrease, thereby enabling brain circulation to return to levels above the range of global ischemic penumbra. Consequently, brain functions such as consciousness, control of respiration, and stimulation of thyroid hormone synthesis itself would all resume. Unfortunately, while brain circulation is still within the range of ischemic penumbra of between 50 and 20% of the brain of the normal level, rendering the brain tissue still viable. Patients are routinely subjected to the so-called apnea test, meaning that mechanical ventilation is stopped for at least 10 minutes, allowing brain circulating carbon dioxide to increase to high levels. The consequences are sudden drop of arterial blood pressure, sudden worsening of intracranial hypertension, and a potentially irreversible collapse of brain circulation. That leads to further damage to the brain. One can ask oneself if one would survive a period of 10 minutes without breathing. If not, would a patient in such a critical situation survive? The apnea test is indeed a fundamental dismissal of the most basic principle of medical practice, known as the principle of non-maleficence, meaning the duty to avoid causing harm to the patient. In other words, apnea testing may cause the very irreversible damage that is merely intended to diagnose. In the case of transient cardiac arrest, causing transient brain ischemia, is currently known that neuronal cell death is an enzymatic process that may take several hours to become irreversible. During this initial period following cardiac arrest or neonatal hypoxia ischemia, this enzymatic process may be inhibited or halted by inducing moderate hypothermia after transient brain ischemia. Moderate hypothermia means reduction of body temperature to 33 degrees Celsius for several hours, thereby preventing the demise of neuronal brain cells. This is an example of scientific knowledge that was not available by the time the designation of irreversible coma changed to brain death. The therapeutic use of moderate hypothermia may not apply to victims of head trauma, as blood clotting is inhibited by hypothermia, consequently worsening brain hemorrhagic phenomena. Following thyroid hormone replacement and or post-ischemic moderate hypothermia, neurological recovery may be optimized with additional agents that can further neutralize or inhibit the formation of reactive oxygen species and block inflammatory events. Thereby, the survival of affected neurons would be optimized. Thyroid hormone replacement should urgently be implemented in any of those patients who are in a state of progressive deepening of coma state to save their lives. In conclusion, comatose patients are currently deprived of effective therapies that could enable their neurological recovery, while damage to their brains is actually induced by apnea test for the sake of transplantation interests. Honest, informed consent for the risks involving the apnea test should be provided to family members so that they know that their beloved one, while in a defenseless condition, will be subjected to a procedure that may induce further brain damage without providing any benefit to the patient in coma. Thank you.
Bardzo dziękuję.
Thank you so much, Professor, from Sao Paulo, from Brazil, very far away from us, but still so close to us. So global technology enables that. My nie słyszymy.
Gdzie mamy możliwość łączenia się z panem profesorem Alanem Schumannem.
Okay, Professor Alan Schumann, doctor, professor in neurology, pediatrics at Medical Faculty, California University in LA, and he's also head of neurology department in Olivia UCLA Medical Center, Silmar. Professor Alan Schumann, can you take the floor right now? Over to you, Professor.
Is that an invitation for me to begin speaking?
Yes, please.
Yeah, okay. Well, thank you very much. It's a great honor to be invited to speak with you all in the Polish Parliament about this important topic. I was asked to address 2 points. First, my opinion about brain death, and second, about presumed consent for organ donation. So the term brain death can mean different things. It can mean death of an organ, as Dr. Coimbra was saying, necrosis of the organ, the brain, or it can mean death of the patient by virtue of a brain lesion. There is a great discrepancy between the legal definition of brain death and the practice of brain death. So I don't know how it is in Poland, but in the United States and most countries, the legal definition requires absence of all functions of the entire brain, and that absence be irreversible. In practice, not all functions are required to be absent, and irreversibility is not actually established. So there's this important discrepancy which inspired the United States Uniform Law Commission even to consider redefining the statutory definition of death to be more concordant with the medical practice, rather than forcing medical practice to concord with the law. That effort to redefine death legally could not get off the ground, and it was tabled. So the law remains what it has been since the 1970s. The common factor between all of these various definitions of death is that, of brain death, is that however you define brain death, it is considered to be death of the patient. Now, how did this equation come about? It began in 1968 with the Harvard Committee report, which declared irreversible coma to be death. They did not give any reason for that in their report. They did not define what they meant by death, or why they thought that irreversible coma ought to be death, except for pragmatic reasons, the most important of which was to facilitate transplantation. And there was a structural conflict of interest on that committee. In addition to 3 neurologists and 1 neurosurgeon, there were 2 transplant surgeons. The chairman of the committee was an anesthesiologist whose only contact with brain-dead patients would be in the operating room for transplantation. So the Harvard Committee really put the cart before the horse, as we say in an English proverb. I say that brain death was from the beginning a conclusion in search of a justification. And people are still searching for the justification. There are 3 main reasons that have been given.
Excuse me, Professor Schumann, could you please say a bit closer to the microphone?
Hard to get closer. Is that any better?
That's okay. That's okay. Thank you. Thank you.
Okay. So the so-called mainstream rationale is that the brain is the central integrating organ of the body, and without brain function, the body literally disintegrates and is no longer a unified organism. This was the mainstream theory that was proposed 13 years after the Harvard Committee already introduced brain death. But it really has fallen by the wayside. Only about 1/3 of neurologists and intensive care specialists actually believe that justification, because it just doesn't work. And time does not allow me to explain why that justification is false. But if you want to ask about it in the question session, we can discuss that. In the United Kingdom, they have this idea that apneic unconsciousness per se is death. And that is an opinion that I think is very idiosyncratic and is not shared outside the United Kingdom. About half of neurologists and intensivists think that brain death is death because it involves a loss of personhood, and the basis for the loss of personhood is irreversible loss of consciousness. No country, as far as I know, has adopted this rationale for equating brain death with death, because it would apply not only to patients with totally destroyed brains, but it would apply to all patients in so-called persistent vegetative state and many comatose patients short of being brain dead. If you look at a so-called brain dead patient in the ICU, they are not really all that different from many other patients in the ICU. They require assisted ventilation. They may require pressor medications to keep up their blood pressure. They may require hormone replacement. But otherwise, they are not physiologically significantly different from many other patients in the ICU, who everyone considers quite alive, although very sick. Now, in practice, ever since 1968, the diagnostic criteria for brain death have been progressively loosened in order to increase the number of patients diagnosed with brain death in order to facilitate transfer. I turn now to the question of presumed consent. And there are really three consents at issue here. One is consent for organ donation. The other is consent.
Just a second, Mr. Professor, just a second. We have a technical problem. Przestało piszczeć. Teraz jest już lepiej, czy dalej piszczy? Dalej. Okay. Mr. Professor, let's start again. Sorry for interrupting you. Just please continue.
Okay. So there are three types of consent at issue here. One is consent for organ donation. One is consent for a brain-based criterion of death. And one is consent for apnea testing. And the government, no government, has any basis to presume that an ordinary citizen would have given consent on all three of these. Why is that? Because, as Dr. Byrne insisted, consent must be informed in order to be consent at all. So I'm going to consider these three types of consent in reverse order. First, the apnea test, which is part and parcel of the diagnostic criterion employed by neurologists and neurosurgeons and intensive care specialists in ICUs following the standardized protocols that have been dictated to them by their specialty medical societies. So the apnea test is a required test. As Dr. Coimbra mentioned, it provides no benefit to the patient. It is harmful to the patient. And surprisingly, it does not even reliably accomplish its own purpose. The purpose is to determine whether there is any potential for spontaneous breathing. And the way the apnea test is done does not reliably accomplish that purpose. And again, if you want to ask about details why I say that, we can talk about it later. Moreover, ironically, according to these diagnostic protocols, brain death can even be diagnosed without an apnea test by including what they call an ancillary test, such as a test of blood flow to the brain. Sometimes the apnea test cannot be performed because the patient is too unstable. And so they don't even attempt it. Instead, they do a blood flow test. So according to the logic of these protocols, they are requiring a test that has no benefit to the patient, is harmful, does not accomplish its purpose, and the diagnosis can even be made without the test. So why in the world should it be required? I think if anyone were informed about the apnea test ahead of time, no one would ever consent to it. And this is one reason that the American Academy of Neurology and other specialty societies that are promoting brain death oppose requiring consent for the apnea test, because they know if consent were requested, it would never be given. I turn now to consent for a brain-based criterion. Well, no one is informed that if they become an organ donor, their heart will be spontaneously beating at the time it is removed from their body, along with other organs. No one is informed that after they have been declared dead, their body maintains homeostasis, which is the endogenous maintenance of physiological parameters in their proper range. No one is informed that their body maintains temperature after they are declared dead, or that their body continues to make urine normally, or assimilate nutrients, or that wounds heal, or that pregnant women can gestate fetuses and give birth to healthy babies. No one is informed of any of that. No one is informed that there is a heated debate among experts whether brain death is death. And that's a very relevant piece of information, I think. No one is informed that the diagnostic criteria for brain death have never been validated, and there are documented counterexamples of people who have been declared dead according to these criteria who recovered some brain function. And no one is informed that the diagnostic criteria are not always followed in practice. Finally, I turn to consent for organ donation itself. So many people would legitimately insist on a circulatory criterion for their own death and not have a faulty criterion imposed on them by the government or the medical profession or anybody else. But most people who are registered as voluntary organ donors are not aware of any of these facts that I've just said. And certainly many, if made aware of these facts, would want to withdraw their donor status. Instead of information, the public receives propaganda from the transplantation industry about the gift of life and things of that sort. But they do not receive the information necessary for informed consent. So, in conclusion, brain death is it's a falsehood. It's a term to describe a live patient who is in a deep coma. The consent for organ donation to be true consent must be informed, and consent cannot be presumed by the government because the public is woefully uninformed. Thank you.
Bardzo dziękuję panu profesorowi Szumon za wyczerpujący materiał, do którego możemy w zasadzie przyjąć tylko opinię, to znaczy
Professor Schumann, thank you very much for your opinion. We believe that it's clearly stated, and it's a clear conclusion from your speech, that you can only harvest organs from a person who is not a living patient. I would like to also welcome Madam Christine Brutz, who I haven't welcomed because, well, I'm sorry if I haven't noticed you or if I haven't stated that you were here with us. Christine, thank you so much for being with us. And we will give the floor to you later, but now I would like to invite Dr. Doyen Nguyen. Dr. Doyen Nguyen is a hematologist. So, I give the floor to Dr. Doyen Nguyen, hematologist, a moral theoretician, a bioethician, an author of publications, books, both in medicine and theology and bioethics. Among her recent publications, we can find a 600-page monograph on new definitions of death for the needs of organ donation. Dr. Doyen Nguyen, are you ready to take the floor? If so, please.
Thank you for inviting me to this meeting on implied consent, which means presumed consent on organ donation. On November 5th, I already sent Mr. Fritz my article, Brain Death, Organ Donation, and Presumed Consent. It contains more details than what I can present in 15 minutes. And also, I have screen sharing, so you should be able to see, instead of having me on the screen, you should be able to see the slides, yeah? The PowerPoint slide, which I sent to Ms. Gluszowska on Sunday night for translation. So please switch, because I already shared the screen, yeah? If you want to see the presentation, because I will speak a little bit fast. So, currently, the source of organ transplantation, the bulk of it come from deceased donors. And there are two kinds of deceased donors. Brain dead donors, also called heart beating donation, meaning that at the time of organ removal, the heart is beating. And the non-heart beating donation, also known as donation after circulatory cardiac death. I will not be speaking very much about DCD, donation after circulatory cardiac death because basically it is built on the BD paradigm. Because as you see here, as part of the Maastricht protocol, which is used in Europe, there is a 10 minutes waiting after the patient had cardiac arrest under controlled condition. And then during those 10 minutes, it is presumed that the brain will be dead, and the result would be a situation equivalent to brain death. In any case, the practice of DCD requires informed consent. And so I will not speak about it in this. The moral question that we all have to ask is, are the so-called disease donors, in this case brain death donors, dead at the time of organ removal? So in order to understand what brain death is and whether the donors are dead at the time of organ removals, we have to ask, what is death? So death is both a single metaphysical event and a biological phenomenon. A metaphysical event is the separation of the principle of life, which you also call the soul, separating from the body. That is the corporeal reality of the person. This is a quote from John Paul II in his 2000 address to the to organ transplanters. A biological phenomenon, it's referred to the process of disintegration which occur immediately after the death event has occurred. The biological process applies equally to related species of the same genus. The genus human species belong to the genus of warm blood mammals, which means that the biological signs indicative that a person has died are no different from those observed in other warm blood mammals. That is like your pet dog, your cat. And this biological phenomenon of disintegration is not alterable by any future changes in technology. The biological phenomenon of disintegration is the result of the cessation of all vital functions in the human body, as evidenced by absence of heartbeat and respiration, beyond the possibility of resuscitation. Now, please note that this phrase, the cessation of all vital functions of the human body beyond the possibility of resuscitation, this phrase was the medical definition of death before brain death was introduced into the clinical practice in 1968. And it corresponds to what we call death in the full sense of the word, or death simpliciter, or in French we call death tout court. Okay? And this is death as we know it when somebody dies at home, in hospice, in hospital ward. And this definition of death is still valid today. So what is brain death? Now that, actually, what is the biological phenomenon of death? The disintegration process. The first sign, the earliest sign, is a rapid drop of temperature of the corpse, all right, to the level of the ambient temperature. And after that, you have a liquefaction of the vitreous gel in the eye, right? And then after, soon after that, you have blood draining from the surface capillaries into the deep veins, leaving the skin paler than life. And then within about 48 hours, you get livor mortis and rigor mortis. Livor mortis is the purple discoloration resulting from blood pooling in the dependent body parts. And this discoloration disappears in the embalming process when blood is drained from the corpse. And within 48 hours, there's a greenish black palette of bacterial growth appears on the patches of skin. And follow that, you get the dissolution of the corpse into liquid and gases. And this process actually begins within minutes of death, but then it becomes noticeable within 2 or 3 days and petrify, and you can say that the corpse stinks, yeah? And because of the gradual liquefaction of soft tissue, organs are the first parts to liquefy, starting with the eyes, proceeding to the brain, the stomach, and the liver. The one important thing is that artificial interventions, such as chilling, embalming, can only slow down, but cannot stop the disintegration process. At this point, now that we know what death is, we can proceed to ask, what is brain death? Well, we have a report, the very first sentence, our primary purpose is to define irreversible coma as a new criterion for death. Just reading that sentence, we know that brain death is irreversible coma. Well, you have to ask yourself then, does changing the definition of death change the reality of the phenomenon of death? Does changing the definition of coma change the reality of the phenomenon of coma? What is coma? Can death and coma be conflated as one and the same reality? Well, coma specifically means a state of sleep-like, unarousable unresponsiveness. The phenomenon of coma, however irreversible it might be, is totally different from the phenomenon of death. A comatose body does not disintegrate and putrefy, whereas a dead body, a corpse, does. Simple as that. Yeah? So, you have already heard about the diagnosis of brain death. Basically, according to the American Academy of Neurology guideline published in 1995, update in 2010, update in 2023, the diagnosis of brain death rests on the triad of coma, that is absence of responsiveness to noxious stimuli, absence of brainstem reflex, and absence of spontaneous breathing as confirmed by the apnea test. But what people rarely notice is that the AAN guidelines stipulate that the diagnosis of brain death remains valid even when the patient manifests normal blood pressure and absence of diabetes insipidus. What is diabetes insipidus? It refers to the massive loss of water and electrolytes through urination. Okay? And that the absence of the absence of diabetes insipidus and the presence of normal blood pressure means that the brain is still secreting antidiuretic hormones, ADH. The AAN guideline also said the diagnosis of brain death is valid even when the patient manifests spontaneous movement or reflex movement of the limbs. And even when the patient has increased heart rate and blood pressure, sweating, blushing, shedding tears at the time of organ harvesting. Well, very clearly, you're going to ask yourself now, if brain death is death, since when does a dead body, a corpse, manifest movement, sweat, have spikes in heart rate and blood pressure at the moment of organ removal? And moreover, if brain death is loss of all brain function, how can the brain still make ADH? Furthermore, after a patient has been declared brain death, we have all sorts of medications and support to manage the brain dead organ donors. And according to a study by Fonseca, there's a bunch of drugs that have been used to maintain the person, the brain dead donors, now already declared dead, to maintain the person hemodynamically stable using dopamine, epinephrine, noradrenaline, and so on. And also there's cardiac monitoring of the patient, control of the ventilators, parameter, correction of any kind of fluid electrolyte disturbances, and use of hormones, including thyroid hormones, as well as insulin. So ask yourself again, can a corpse that is a truly dead body, like some dead body that you find in the morgue, respond to therapeutic interventions, drugs, hormone, ventilator, and cardiac monitoring? At this point, I give you some real-life account. These were the words of the late philosopher Robert Spemann. At the Pontifical Academy of Science Conference in 2006, Robert Spemann said that he reported what physician Peschke mentioned. And Peschke report that nurses in transplantation do not want to donate organs nor receive donate organs. Because why? Because when they are working with these brain dead donors, already declared dead, suddenly there's an arm from the donor coming up and touch the body of the nurse or reaches around the body of the nurse. It's terrifying. The nurse is told the patient is dead, and yet the patient is moving. And these brain dead donors are usually also given anesthesia during the either prior to organ harvesting, just before you remove the organ. The question is, does one anesthetize corpse? At this point, before I speak on consent, I would like to go over ethics of organ donation. There are three fundamental moral principles. First is to preserve innocent life. And here this corresponds to the Hippocratic Oath, primum non nocere. First, do no harm. The second principle is we cannot do evil for the sake of good. Because if we do evil for the sake of good, it's called moral consequentialism. That is, the end justifies the mean. That is utilitarianism. And the third moral principle is that a human person cannot be treated as an object of use, as the means to an end. And this comes from Wojtyla, John Paul II, in the book Love and Responsibility. This is referred to as the personalistic ethical principle. So we have to ask ourselves, are these ethical principles being followed by the current practice of organ donation? Why is consent necessary? It's necessary because of the principle of respect of person. The term consent refers to the act of giving a permission, an approval, an agreement. So to be valid, a consent must be given freely without coercion or deception by a person to an agent with sufficient mental capacity to give it, meaning that either the donor say that he wants to be donated organ at the time when he signed his driver license, like in America, or he has a donor card, right? Now the notion of consent in organ donation is derived from the practice of informed consent in other medical fields. The person gives consent to various procedures for the purpose of diagnosis, treatment, or clinical research. The notion of consent is founded on the ethical principle of respect for person. And this is an expression of the personalistic norm, which I mentioned already. And when the personalistic norm is applied to medical science, this norm means that the welfare of the individuals take precedence over that of science and society. The principle of respect for person has also been the cornerstone and foundation of secular medical ethics. Respect for person entails both respect for autonomy and therefore respect of the patient's autonomous choice, and it also entails concern for the welfare of the consenting subject. So this concern correspond to the principle of beneficence and non-maleficence, which in turn correspond to the Hippocratic Oath, primum non nocere. Okay? So with regard to organ donation, informed consent presupposes that all the relevant information about organ donation has been disclosed to the public. So the question is, how much of the relevant information about brain death has been provided to the public, so that they may know that brain death is not death as ordinarily understood, that is, not in the sense as one speaks of the death of a family pet. And as I think Dr. Schumann already mentioned, the public had not been fully disclosed about brain death. The advocate of presumed consent have argued that once a person is dead, now here we have a play of word, yeah? Truly dead or not really truly dead, yeah? But from the perspective of the advocate of presumed consent, brain dead is dead, all right? So once a person is dead, what is left behind is a corpse, a cadaver. And that is a thing. In Latin, we call it a res, which then means that the organ of that dead person must be made available in a way that maximizes the benefit of living patients who are on the waiting list for organ transplant. And some ethicists have argued that the refusal to donate one, quote-unquote, post-mortem organs, wasting them through burial or cremation at the cost of other people's life, is morally unacceptable because it puts the interests of the dead above those of living persons. Well, we know very well that these arguments from advocates of presumed consent are not valid. Why? Precisely because brain dead donors are not dead. Okay? Now, it's also clear that the main reason for making presumed consent a law is the utilitarian motive that any measure that increases the supply of organ transplantation is a good thing. The argument of by advocate of presumed consent for organ donation is also based on the data of surveys. Public polls in several countries at various times have shown that the public supports organ donation. For instance, the polls in Germany in 2014, and this was before the country changed its policy to presume consent in 2020. So the survey then reported that 71% of the respondents indicated that they would donate organs. So based on this kind of data, the advocate of presumed consent argued that it'd be safe to assume that people who have not explicitly refused to donate wish to intend to donate their organs. Now, in that same survey in Germany, only 1/3 of the respondents actually carry a donor card. And surveys in other countries such as United States or in France show similarly a large gap between the percentage of people supporting organ donation and the actual percentage of people registered as organ donors. So we have to ask ourselves, why such a large gap? Well, such a large gap can only mean that the public have doubt about organ donation. They have reluctant to donate organ. Therefore, it is presumptuous to assume that people consent to organ donation when they have not explicitly stated yes or no. Now, there's only one place where presumed consent is legitimate, and that is in life-saving interventions in emergency situations. But the logic of presumed consent in organ donation totally differs from that used in emergency settings. In emergency settings, life-saving interventions are for the benefit and the welfare of the patients whose consent is presumed. In organ donation, the procedure of organ removal serves the interests of some anonymous recipients. It certainly does not benefit the brain-dead donor. And if anything, the donor dies as a result of organ removal. Last but not least, and actually most importantly, presumed consent is philosophically indefensible. I already mentioned that consent is to authorize someone to allow someone to do something, to agree that someone would do something to me. Yeah. So consent is a public act of authorization. It does not refer to a wish, an intention, a desire that certain action be done. Why? Wish, intention, desire, that's first knowledge. It's a mental state. It's inside the person's head. No third party can have access. So to end, I want to quote from Hard Talk. The presumption of consent does not mean that it can be safely assumed that consent has been given. It only means that it can be assumed that people would consent under hypothetical circumstances. But hypothetical consent is no consent any more than forced money is money. Therefore, presumed consent for organ retrieval is a fiction. In conclusion, then, if presumed consent is a fiction, then to adopt it as a policy and pass it as it were equivalent to actual consent would be ethically deceitful to the public, and this would further compound the moral issue already caused by the brain death paradigm. I thank you for your attention.
Bardzo dziękuję pani doktor Doyen.
Dr. Diane Nguyen, thank you so much. Thank you for your touching and beautiful presentation. Some people say they cannot hear us, so one more time. It's very quiet. I'll try to speak up. I'll speak to 2 microphones. So thank you so much, Dr. Diane Nguyen, for your beautiful presentation, especially very touching when it comes to giving anesthesia to a dead person, which in fact clearly presents the whole issue. Now, before I give the floor to the next speaker, first and foremost, let me welcome people whom I haven't welcomed yet. We were honored by their presence by Agnieszka Kutyłowska, Marta Czech, Justyna Krasowicz, and Mr. Konrad Kopyś. Welcome. And now, ladies and gentlemen, a speaker who is Polish. And we don't really have to introduce him in Poland, but I think it's worth commenting on Father Dr. Jacek Marian-Norkowski. He's a doctor and a Dominican graduate from Medical Academy of Poznań. After he graduated, he joined the order, Dominican order. He studied theology in Krakow, and in 1989 he became a father. He was ordained, and what is particularly important for us at this meeting, he used to cooperate, and he wrote his PhD under Professor Jan Talar, whom we send kind greetings to if he's watching. And so this is a person who has a lot of accomplishments in the area of medicine and science and the things that we are talking about today. Father, over to you. Shall I speak Polish? Yes, please speak Polish. Okay, it's always easier to speak Polish. Thank you so much to everyone invited that they agreed to participate. And we already said a lot of things that are important, and they boil down to the fact that the death criteria, brain death criteria that were implemented after 1968, last century, so they are very utilitarian, so harvesting organs while diagnosing death based on criteria that are shouldn't really be used for determining death. It's falsified criteria, you can say, and falsified death definition. In Europe, recently, we've been using this definition, which was adopted at a Montreal conference in 2012. Where death is permanent loss of consciousness and permanent loss of all brainstem functions. It can be caused by permanent cessation of circulation or critical brain damage. And there's no talk here about death of the whole brain, just like in the States. So in Poland, we are talking about permanent cessation of all activities of brain stem and permanent loss of consciousness. But it's worth pointing out that in practice, this means that, for example, in Poland, a patient who has less than 7 on a Glasgow scale is considered to be a patient who already lost consciousness permanently and can be a donor. While we know full well that with right treatment, as Professor Kolimbra said, with right treatment, if you use therapeutic hypothermia, such a patient who had this Glasgow scale score, loss of consciousness, who had the worst possible outcome, so 3 points on a Glasgow scale, can still be treated, and he can survive and be in good condition, and this applies to more than 60% of patients. And in Poland, with much higher level of consciousness, patients are refused their right to treatment. And it's worth pointing out that in Poland, we don't use therapeutic hypothermia, which is required in many countries. And it's a routine measurement. In Poland, we don't have it at all. So patients who have a brain which is which has edema and which has global ischemic penumbra, so if they are in this condition, they are not treated properly, and you can simply say that is therapeutic nihilism. So nothing is done to manage brain edema in patient in whom edema occurred. You don't use intracranial sensor, so you don't really know what the pressure, intracranial pressure is. And you don't use any radical methods to decrease pressure. The best method would be therapeutic hypothermia. In Poland, in such cases, it's not applied at all. And there's also radiectomy, removing a part of cranial vault in order to eliminate hypertension in the brain, intracranial pressure, which is very high and can cause secondary brain damage. So this surgery is seldom used in Poland. And there is a third problem in our country, namely, patients with brain edema are inducted into therapeutic coma and administered sedatives, drugs that are used normally for surgery. It's a continuous infusion of more than one, sometimes 2 or more drugs that are normally used for putting patients to sleep and for anesthesia before surgery. So if this is a continuous infusion for a day or longer, for several days and nights, you might say that this causes a secondary chemical brain damage. So as a result, the patient is not able to recover stem reflexes based on which you determine if they are missing. You can determine or diagnose brainstem death, and you diagnose death. So you don't wait long enough for the drugs to be washed out, and the patient who's still under the influence of those drugs is still considered dead because he doesn't have brain stem reflexes and has got apnea. So there's another thing. We were talking about this cruel practice of using apnea test by switching off the respirator. In Poland, it's done for 10 minutes. Ventilator, and even if the patient moves with hands and legs, and even if he or she has a shallow breath, it is said that these are movements which are similar to breathing, but the volume of thorax does not increase. But in fact, it's a shallow breath, which is not thought to be a result of brain function because it's shallow. So patient with shallow shallow breath means this patient is not breathing at all, thus the patient is dead. So these are the current criteria in Poland. And people don't know about this at all. If you tell them about it, they are surprised. They are all convinced that organs are harvested after death. Although it doesn't sound logical, that they simply cannot understand that you cannot harvest a beating heart after a true death. But some people, also my colleagues from my order, were convinced that organs are harvested after a true death. So the rule of presumed consent is based on the fact that people don't know what brainstem death is. It's fictitious death. It's diagnosing or you're ridding the patient of the right to be a patient or a citizen. The patient is qualified as dead and stops being a patient. There's no therapeutic duty vis-a-vis such patient anymore, but it's a living person, a living body. We are not checking the consciousness of these patients, the awareness of these patients. We are not checking the functions of the brain that are responsible for hormone production, and death is determined. So Professor Talar in Poland healed a large group of people in Poland vis-a-vis or for which a committee was supposed to meet on the next day and determine brain death. So a lot of such people were relocated to Professor Talar's clinic. They survived and were rehabilitated. They were able to go back to normal life and have a family. So in reality, the condition of patients with brain edema that falls under brain death definition, what Professor Coimbra said, that these symptoms are considered to be symptoms of brain damage too early. They are reversible, and patients have a chance to heal and live. It doesn't apply to all patients, but to a vast part of them, large part of them. But the problem is that if the body is living, we cannot determine death. And these are not bodies, as some try to define it. They are living bodies. So this is a human being, but well, it's a human being, but not a personality. So the hypothesis is that it's someone who's not a person anymore, even though their body is alive. So in fact, it's a human being, but it's not a person. So this was proposed to say that we are not harming anyone who would be a person. But this is done by presumption that an unconscious person is permanently unconscious, even though we have evidence. For example, Zachariasz Dunlop, who was brain dead, but he heard everything that the members of the committee were saying, and his consciousness level was quite high. So this is just an assumption that these people lost their consciousness thoroughly, because simply we are not investigating, we are not testing the level of consciousness. We have no duty to run EEG test in Poland or other specialist tests that would check a patient's response to verbal signals. For example, tests carried out by Dr. Koczubej in Germany, who showed that patients in deep coma were sometimes able to understand human speech. So these tests are not done. We assume there's a loss of consciousness without that there is a coma without checking consciousness, so not even knowing what the level of consciousness is in the patient. And we don't give the patient a chance to heal because we are not using effective measures to take care of brain edema. On top of that, a person in this condition is not really a dead person. And the body is alive. This patient has a chance to heal. And this information is not known to the general public in Poland. The general public hear in the media, day in, day out, that we are harvesting organs after donor's death. And they even appeal to religious feelings not to take organs to heaven with you. But an important institution, Catholic Church, is silent. Its representatives are silent, even academic lecturers, and they never rejected publicly these criteria. On the contrary, they supported the criteria also from point of view of the Catholic religion, as if we were to agree to the fact that we have a living body without a soul. This is not in line with the teachings of the Church, which highlights that the soul is form of a body. So as long as the body is alive, the soul has to be there. So this has to be a living person and a human being. And thank you so much for the time that you gave me for my lecture, for my intervention. Thank you very much. Father Jacek Norkowski with his intervention. And now could I ask Christian Blusamley for just a moment, a short intervention, madam. We are pressed for time. So Christine, she had to do with a case. The whole world heard about it, Alfie Evans. This is a side topic for today's meetings, but please take the floor and present your case.
Dziękuję.
Thank you very much. So distinguished guests and distinguished doctors, I'm very, very pleased to be with all of you today. My name is Christine Brosemley, and sorry, you cannot. Okay. Is this better?
Hello.
Działa?
Tłumaczenie słyszymy.
Działa?
You can hear the interpretation.
Yes, I can. Thank you. All right. So, now is okay? Okay. So, very briefly, before I talk about Alfie, I don't know if you're aware, but last month in the United States, a man was taken for organ donation in Kentucky. And while they were rolling him down the hall with his family holding his hand, his eyes opened and he looked around. The family were told this was just normal reflexes, that he was still dead. When they took him into the operating room, the man started crying and pulling at everyone, and finally started pulling out his own teeth. Two of the organ procurement company assistants, who have seen all the organ harvesting in the world, both quit their jobs in protest of this. Thank God the man's life was saved. He's alive today. He's, of course, suffering from bad treatment and brain damage, but he is alive and he is relational. He is smiling. You can read him in the newspaper. So, the death of, well, first I'll introduce myself. Alfie was killed by direct lethal injection, which is technically illegal in England. That would be called direct euthanasia, but it was allowed by the court because they were determined for him to die. He was killed in Liverpool, United Kingdom in April 2018. I was the central coordinator of the defense of his life, along with the barrister coordinating the legal battle. I spent 9 months completely dedicated to the case on the ground in Alfie's hospital, working with lawyers and medical experts, and present in all the negotiations and in the courtroom. The death of Alfie Evans was done fully against the wishes of his parents and every member of his family. Their denial of consent was completely overruled in an extremely public fight involving the voices of 3 governments outside the UK: Italy, the Vatican, and Poland. President Andrzej Duda, in union with Poles protesting on the streets all over the world, posted a tweet on behalf of Alfie calling for him to be saved. We were also assisted by Polish doctors who came to Liverpool and lawyers and doctors here in Poland. So for the voice of a united Polonia on behalf of Alfie Evans, we will always be very, very grateful. The issue of consent for organ donation played a role in Alfie's drama. His parents actively refused consent for Alfie to be an organ donor. We're very thankful that that was respected, or Alfie's death would have been even more traumatic and horrifying than it already was. Frankly, I think it was also because it would have looked very bad for the British government. Surprisingly, there was a lack of formal diagnosis as to Alfie's condition until after his death. But the justifications were given for ending Alfie's life as follows. There were claims that Alfie was in an unexplained permanent coma, that Alfie's brain was disintegrated and 90% water, and that he was brain dead. These are exaggerations and lies. The British hospital was able to use these unprofessional behaviors for 3 reasons. First, because this is their long-standing mode of operation, so they know they have support from judges. Second, because they control parents through the very real fear of harm to their child and losing parental rights in the situation, which the British law provides for. Third, because the families are very vulnerable in various ways, including their educational and socioeconomic level, and often do not comprehend how they are being lied to. Most families are completely shocked and unprepared for a fight with professionals who are supposed to be saving lives. The justifications are these. The refusal to diagnose was because Alfie had seizures due to vaccines. There was no mystery to Alfie's coma. It was entirely drug-induced. First by phenobarbital, then by the interaction of multiple anti-seizure medications, which I list in my text. Yet the confused family was frequently begging for Alfie to wake up, thinking that there was some reason he could not wake up, which he did frequently do, and he interactively woke up with them and with many others, including myself. Because the hospital was able to easily manipulate the family, they did not bother being logical about the use of the issue of Alfie's consciousness. One day it was because the seizure medications. Another day, oh, we don't know, it's a mystery. They were equally illogical and inconsistent about the type and severity of Alfie's seizures as a justification for the level of sedation. Oh, he needs them. Oh, well, he doesn't really need them. Oh, the seizures are dangerous. Well, no, they're not dangerous. The family repeatedly requested the drugs to be gradually lowered while the doctors would suddenly raise them again. The second falsehood was that Alfie's brain was disintegrated, liquefied, and 90% water. According to multiple sources, the normal human brain is composed of anywhere between 70 and 80% water. Saying his brain was 90% water is thus a convenient exaggeration. But the interesting thing is there are cases like Noah Wall, born with 2% functioning brain, and Jackson Buell, born with 10% of his brain and living for 5 years, and a Frenchman living normally with a brain considered to be 90% water, without even knowing about it until he was an adult. Clearly, this is no reason to make someone die who is not dying. And whatever happened to the time-proven treatment of brain shunts for relieving encephalitic pressure, or progesterone for relieving inflammation, which is indicated in medical literature for stroke, for example, or DHA for brain recovery. There was a long list of treatments which Alfie was denied receiving, and this is typical in hospitals who are wanting to end the life of a patient, as Dr. Coimbra noted. It was heard on the first day of court that the brain scans the hospital presented for Alfie were immediately protested by multiple family members as not being genuine, so fake. The hospital's desperation to control evidence was also apparent in their running to the courtroom doors when new brain scans were unexpectedly ordered by the judge. Scans which did not prove the claims of 90% water. What also struck me years later was when I saw scans of children traumatized by deprivation in orphanages. From what I could remember, Alfie's scans looked more like a traumatized brain than an injured one. I also heard that children who are not physically held do not develop well cognitively. During the 9 months before the final extubation, the hospital refused Alfie's parents the privilege of holding their own son outside the bed. A break in this policy was only negotiated once, and I was thankful to be able to share in that privilege of holding him. The third falsehood relevant to our discussion was the claim that Alfie was brain dead. The idea of brain death implies that someone no longer interacts, no longer can remain alive naturally, the blood flow is cut off, nothing works. As you can see in the videos that I can present later, Alfie, on the other hand, had frequent eye contact with many people, could respond to requests, obeyed commands from his father, showed preferences as to his comfort, and even smiled at us on video. Physically, he remained chubby and fat and grew even beyond the average size for his age. Last I heard, dead people don't grow or smile or react to anything. The most astonishing thing of all was his holding on to life after being violently extubated. They literally yanked it like that. After 16 months on a ventilator, you should know that the protocols in hospitals are for 2 weeks or less for a ventilator. Otherwise, you have to give a tracheostomy to make it easier to manage and stop the sedation. But 16 months, Alfie was intubated. They pulled that out, and Alfie did not die. Normally, someone would suffocate within minutes or seconds. On top of that, Alfie had already suffered multiple collapsed lungs and rounds of pneumonia, thanks to the drugs he was on and the prolonged intubation. But he lived on for 5 days and only died when 4 unspecified drugs were added to his intravenous line in the middle of the night, which 2 family members witnessed. As Dr. Paul Byrne stated in his personal testimony, he came and visited Alfie with me. Alfie was a living boy, and given the basic care that every human being deserves, he could have gone home and been at peace with his family. What could prevent dramatic cases like Alfie and others from happening again? And what role does implicit or affirmative consent play in this? After my personal experience in several tragic cases after Alfie, I first of all call for the rights of parents and the primacy of preserving life to be sacrosanct. Many court cases and countless wrenching scenes could be avoided if unanimous family consent were required for removing life support for any reason. Instead, hospitals routinely capitalize on manipulating divided families against each other and destroying peace. No one should die this way, especially not when someone is ready to care for them. Second, I call for an end to all live organ harvesting. I have seen too many scenes of screaming families while someone responsive is taken away from them. The stories of people waking up are beyond number. Such vivisection is profoundly disrespectful to the human person. It's against the natural law to take life to preserve life, as you heard Dr. Nguyen describe. I have spoken with organ harvesting is also openly and publicly documented as a horrific trade in China, where prisoners are held without charges and die without mercy by organ harvesting in terrifying circumstances. I have spoken with members of commissions both in Washington, D.C. and in Geneva, Switzerland on this issue, and the torture the victims endure is beyond imagination. We must not enable by our participation such a trade anywhere in the world. We are ignoring volumes of published studies on restoring health. We have never had a wider body of knowledge than now. Why aren't we using it? Finally, in proof of what Dr. Nguyen said about it not being a serious criteria of life if someone cries or has increased heart rate or anything like this at the moment of harvesting. I held the hand of a 13-year-old boy in the United States while ventilation was removed from him, and my experience was horrifying. The hospital pushed hard for organs, but the family refused. A transfer to another hospital was refused by the ICU chief. The lawyer abandoned the family. The boy's brain death tests were the apnea test and cold water in his ear. But the parents suspected that their wishes for the stopping of paralyzing drugs had not been honored. Therefore, the results were not valid. We were surrounded by hospital security personnel, like police, and we could not stop what was happening. When the doctors moved toward the teenager to remove the ventilation tube, I suddenly felt my heart pounding in my hand. But then I felt my chest, and I realized my heart was not pounding. It was the boy's heart pulsing in my hand. He was terrified. He could still hear. He was paralyzed by the drugs and could not defend himself. As a teenager, he knew full well that he was about to suffocate to death. But as Dr. Norkowski notes, nobody tests consciousness. And as Dr. Nguyen showed us, nobody cares about those physical signs of terror. For nearly an hour, I watched his chest and never saw it move. But that pulse kept pounding nearly 60 minutes, and then finally gradually faded in my hand. The ICU chief fussed about why it took the boy so long to die. Like Alfie, this courageous boy fought in the only way he could, and those of us who were present will never be the same. In conclusion, no one should ever have to witness such a scene. No one should ever have their right to conscientious objection overruled. No family should ever have to lose a loved one this way. No transplant is worth such cruelty to human beings. Poland has the facilities to receive international medical refugees, and that should continue. May Poland truly uphold life, safety, and family in every way. Dziękuję bardzo.
Bardzo dziękuję, Christine.
Thank you, Christine. So we have finished our round of expert interventions. And now we have some time for questions to our experts. So if any of you would like to ask a question, please raise your hand. And those who are online, if you would like to say something, you can raise your hand through Zoom, and then you'll get priority. Especially that having such amazing experts, even online, is such a rarity, is such an honor, that if you would like to say something, please raise your hand in Zoom, and you will get priority. Are there any questions from the room? Maybe any of the experts would like to add something? Maybe you would like to comment on what someone else said? Dr. Radkowska, the floor is yours. Dr. Katarzyna, turn on your microphone, please, and you can speak now. Good evening, everyone. Can you hear me? Yes, we can hear you. I'm a physician, a medical doctor, and I specialize in psychiatry. In Poland, I am facing proceedings in front of the medical society because I talked about complications after COVID vaccines, and I treated COVID patients with amantadine, which is an antiviral drug that works, whose mode of action is similar to that of ivermectin. So I wanted to say something similar to what Father Norkowski said. He spoke before. Professor Jan Talar, who works here in Poland, and he saved a number of people, hundreds of people from deep coma, nearly 1,000 patients. And he also experienced trauma, let's say, from our medical societies, because he was suspended as a medical doctor for a year. So this is how they punish physicians who want to follow their conscience. So that's one thing that I wanted to say. Also, one more thing. You were saying something about a human being being a person, and that some people believe that if someone is in a deep coma, they're not a person. They may be human, but not a person. As a psychiatrist, I don't agree. We psychiatrists deal with so-called qualitative disorders. And we have some patients who are in psychosis, deep psychosis, or catatonic patients, where we don't have any contact with them. Logically, they don't respond. We're not in touch with them at all. But those people are persons. They are still persons. They still have personality. And if they get psychotropic treatment, their cognitive, logical, and behavioral functions go back to what they were before, and they are persons. So I, as a psychiatrist, don't agree that someone in a deep coma does not have a person or does not have personality. As a psychiatrist, I find it absolutely unacceptable. And thirdly, we in Poland are now facing a problem of so-called futile treatment. And it's related to Alfie's case, actually. We have similar issues. In May this year, medical ethical code was changed, and right now, physicians cannot offer this kind of treatment. So, futile treatment cannot be used anymore in people who have chronic diseases, who are in daycare, in care facilities, and so on. So there's supposed to be a triage, a segregation of patients before they go to hospital. And they will be using this criteria, that some patients would be futile to treat. So this is a problem that we're facing currently in Poland. Thank you so much. Is there anyone else who would like to ask a question or say something about what our experts mentioned? Piotr Heshen, over to you. I'm very much impressed how the definition of death has been evolving. So I will propose my own definition. Death is when you are completely helpless and you cannot escape those butchers who hold a knife. That could be death. We heard about this case that someone is giving anesthesia to someone who is supposedly dead. That was very interesting. And I'm intrigued when I talk to physicians, as I've been talking to physicians over the course of my life, as I've been reading all kinds of literature, I presume that physicians, especially older ones, apart from knowledge, they have intuition as well. They can use intuition. Intuition is like a combination of knowledge and experience and all that. And I would say God's grace also has some contribution, especially if you believe in God. You definitely believe in the notion of grace. So all of us here in this room, as well as online, we are convinced after those wonderful presentations from our experts that we're dealing with a situation where living persons are being killed. So how come it's happened that doctors, those who should be all for preserving life, nourishing life, finding ways to continue life, how come they are so cold and indifferent? How come that the medical community has become so insensitive, so indifferent to life, to suffering? Thank you so much. Is there anyone from our online speakers who would like to say something? Find some comments, some possible answers?
Nie chciałbym wyznaczać, dlatego
I don't want to point to any concrete people that I'd like you to volunteer, or maybe the answer was so obvious that no one wants to intervene. Well, I could intervene, sure. Yes. May I? Please. Yes, we can hear you very well, Father. Well, the policy of doctors' chambers contributed to that, because they make it impossible for doctors to follow their conscience and their knowledge. Specific standards are imposed, in this case related to brainstem death, but before it applied to standards of treatment that were not in line with the needs of the patient. So this is imposed on all doctors in a mandatory way, and all doctors who are of a different opinion are penalized. Professor Talar, during one of the cases in the doctor's chamber in Bydgoszcz, presented his patient cases where they were asked to give consent, and they were minor, but he treated them. I could show you the pictures if you wanted. Sure, we would like to see the pictures. So the doctor's chamber imposed a fee on a penalty on him anyway. Not sure if you can see now. If you can see the slide. Yes, we can see the slide. Somebody with a snowboard. Yes, this is a picture of Agnieszka Terlecka. She's already, this is after the treatment, a year after the treatment by Professor Talar. And her parents were asked to give a consent. The doctors talked to the mother and the father because she was suspected of brainstem death. After the determination, you wait for 6 hours, and a two-people committee can decide that there is such a death because there are no brainstem reflexes and no spontaneous breathing. So she was saved by the fact that her father found out that Professor Talar had been treating such cases, and when she came to the clinic, after 5 days, she opened her eyes. So to move her to his clinic, diagnosis had to be changed. Preliminary diagnosis had to be changed from brainstem death to brain damage. And so they simply corrected it manually in her files. This is Agnieszka Terlecka. At a later stage, a completely normal person, graduated from 2 faculties, and she was supposed to be an organ donor. And this is another patient, police officer. Police officers were already collecting money for his funeral. The committee was supposed to decide about his death in 2 days in order to harvest his organs, but Professor Talar, when the patient's mother found out and contacted Professor Talar healed him. And here this is an example of a case of Violetta Klisińska. Also, parents were asked to give a consent to harvesting of the organs based on brainstem death, and it was supposed to happen on the next day. But on the eve of this decision, which would simply mean civil death and then real death by harvesting organs, it was possible so Professor Talar was able to bring her out of the hospital and move her to his clinic in the city of Bydgoszcz, where he was working. And she healed quite quickly. This was a rehab, and this is her wedding. She married, and this is her baby. Quite a few years ago, the baby is now bigger, so she's a happy mother. And these are other similar cases. A patient with big brain damage, Professor Talar treated her. He saved her. The parents opposed, fought with the doctors, didn't agree to organ donation, and now she's a grown-up person and she graduated from university. And another case, she was supposed to be an organ donor, and after a few years, she now is a happy mother. And it is important to say that sedatives such as fentanyl, propofol, thiopental, and many other sedatives are administered also in IV infusion that takes days, often more than one sedative, which infects the brain, and it's hard to rehabilitate. The patient is damaged for their whole life, and this is a standard in Poland that such medications are administered in patients with suspicion of brainstem death before the committee meets and decides that this is a dead patient, that it's a corpse with a beating heart. And that's another fiction and another oxymoron. And the problem is that we cannot be sure how long you need to wait to decide on brainstem death. So in other words, lack of reflexes of brainstem, how long you have to wait for the medication to wash off. Nobody controls that. We can assume that in the majority of cases, the action of these drugs makes it impossible for reflexes to be brought back. They could survive if only they had been treated correctly, because the reflexes would have come back. So these are transient symptoms. When there's edema of the brain, they are not irreversible. Reversing these symptoms takes at least 2 days or longer, and there's a chance for the patients. And here, eyes of the patient, pupils are checked. They come back to normal. This is the word of those patients with ventilators. And after a while, the patients would come back to normal. So you can see that a dilated pupil may not only be dilated because of brain damage, but also because of sedatives that were administered to the patient. But the patient, when he or she is rehabilitated, they go back to normal. The pupils go back to normal. I'm running through it quickly because we are pressed for time, and I wanted to show you some other cases. Anyways, I guess this is all when it comes to pictures of patient cases. Professor Talar, who has a lot of accomplishments in Poland, he wasn't really appreciated or understood. And unfortunately, he's had difficulties. Now he's working at the clinic. And I'm speaking on his behalf because he had concerns that if he says too much truth, he might be penalized. So that's it from me for now. Father Jacek, thank you very much. Do we have Dr. Paul Byrne with us? Because I wanted to ask you a question, whether in your career as a doctor, speaking of the cases that Dr. Norkowski has just mentioned. So, Dr. Byrne, did you have any such cases where the doctors asked for consent for harvesting of the organs and then the patient survived? Would you have such examples, doctor?
Pan Dr. Byrne, please switch on the microphone.
No. Okay.
Yes, please. We can hear you.
Hello?
Yes, Dr. Byrne, please go ahead.
been listening, but of course, the things in Polish I cannot understand. The examples of people who have been declared brain dead and are not dead are there because there's clearly a difference between life and death. When the life leaves, what there is destruction, and the destruction begins very quickly. It's called autolysis, if you put the words together. It's autolysis. It begins within a very few minutes. That is followed by decomposition and decay. And of course, we can know that has occurred with rigor mortis in the muscles, but we don't have to wait for that. But no one should be declared dead unless there is destruction of at least the three vital systems: the circulatory system, the respiratory system, and the nervous system, with the focus on the brain. It's very, very important that the focus be on life and death, that what we have had to do for the last 40 or 50 more years is to untell the lie of brain death. Brain death means alive. It's a lie. It's been alive since it first got published. The focus at this time ought to be on life and death, and realize that their brain death is not death. And there are plenty of reasons, as many of you have said, those I understand in English, plenty of reasons to know that the person declared brain dead is not dead. We need to realize that and then go forward, but we must go forward based on life, which begins at creation. At creation, there's a unity of the body and soul, and that unity of the body and soul is a continuum before and after birth, continues all the way to the event of death, and the event of death is the separation of the soul from the body. What is left on earth are the remains, and the remains can be identified as destruction, which begins quickly after the soul leaves, after the life leaves, first as autolysis, and then goes on with decomposition and decay. Thank you.
Dziękujemy.
Thank you so much. Anyone else who would like to say something? Justyna Socha, then Oskar, and then Anna Kubala. So now Justyna. So I would like to give a comment, a technical comment. If our guests cannot hear Polish, we need to give them some instructions as to how to turn on interpretation.
I suppose that we are providing simultaneous interpretation, and if you see the globe at the bottom of the screen, there is a globe, and it should say translation, and you should be able to click on the globe and click on English, and then you should be able to hear our translation. At least that's my hope. I hope that our translation is connected to the internet. Can we check that if you can hear us? Can you just test the globe? Click on the globe and choose English. And my colleagues will be testing.
Hopefully you have already done that. There is an icon of a globe.
Yes, globe icon at the bottom, and it should say translation or simultaneous translation.
Interpretation. So I will ask, can you hear us? Can you hear our Polish? Can you hear our 1 2 1 2 1 2? The interpreter is speaking right now. Hopefully you have set your interpretation you have activated the interpretation function. Can you hear the interpreter?
What you do is you go to the bottom of the screen, you see a circle with 3 dots that say more. You click on more, and there you will have the menu on the 3rd line. And there's a globe that says interpretation. You click interpretation. Yeah?
So, can you hear right now? Hopefully, everyone has activated interpretation.
Słyszą?
Did you find this?
It seems like you have found interpretation. Can you hear the interpreter? Hopefully you can. If our international guests couldn't hear our discussion, or you could hear but couldn't follow, let me tell you briefly that in Poland there is a professor called Professor Talar, and he wakes people up from even the toughest of comas. And Father Norkowski gave some examples. And this professor who wakes people up got suspended. His medical license got suspended, but he actually treated nearly 1,000 of patients from very deep coma. I mean, some of them were already designated to become organ donors, but actually they woke up thanks to Professor Talar. And now over to Justyna Socha, who will make a comment. Thank you for inviting me. Thank you for organizing this conference or this meeting on a very important topic. I participated, or actually, I had some proceedings against me in 2021. I also accompanied Professor Talar, who had proceedings against him, and I saw those patients who were supposedly dead, but actually they came physically to support his doctor because they were not dead. All of those patients were absolutely melted and crying, trying to support this doctor, but the medical panel suspended him. He also went to a court hearing. He presented photos of his patients. He presented medical records. But the medical board, again, was unwavered. I went to the Supreme Medical Board, where Professor Talar was in proceedings against him. But again, nothing changed. Those people on the medical board, they don't represent the interests of patients. They represent the interest of the industry who profits from transplantations and transplantology. Together with my colleague, a lawyer sitting next to me, we found an article in the media that among young people in schools, they have been circulating consent forms among young people. When I published in 2002 a post on social media about this inhuman treatment, because now we have presumed consent instead of informed consent. And I published on social media a protest saying that this can save people's lives. And I quoted Professor Talar saying that organs are harvested from living people. And I got attacked by all kinds of media, all kinds of people. And recently, I was also convicted as a journalist, as a social activist. I fought against the so-called quiet or silent euthanasia, but I was sentenced 30 hours of community work a month and 20,000 zlotys. But actually, I don't want to tell you about this. I want to tell you about Szymon, who is like whose case is similar to that of Alfie Evans. Actually, Szymon's mom, she also spoke publicly in 2020. So let me read you the story about this boy, Szymon. He never lived to see his first birthday. In 2019, he got a vaccine. And then after that, even though his immunity was compromised, and after that, he had brain death. And doctors said, we will not ventilate a dead body. But actually, he was saved by his aunt, because his aunt published his story on social media. And it was very alarming. It created outrage in the society, so the boy was saved. But then the family called my organization, and finally the organization got a lawyer, and the parents had a voice. Then they were looking for some hope for Alfie. They used physical therapy for the boy. They worked with Professor Talar. Then there was, it turned out that this vaccine was defective. It had some contamination. And actually my organization received 150, we heard thousands of cases of adverse effects after this vaccine. The boy Szymon had 2 apnea tests, and his parents were not informed about the possible consequences. Then in June, a medical board, a medical panel came together, and they knew what was about to happen. But actually, on this medical panel, there was no physician that the parents trusted. Professor Pinkas, Professor Jackowska, Mikołaj Pawlak, the ombudsman for children's rights were there. When Szymon died, on that day, actually, the mother received a phone call from the ombudsman for children's rights, and he said that it was impossible to stop it. So actually, it takes 3 signatures from 3 physicians to take life from a child who is brain dead. So it doesn't even have to be a court. 3 signatures from 3 people. And the ombudsman for children's rights actually tried to discourage the parents from seeking help, from using a lawyer. And then 3 doctors signed a verdict saying that the boy is brain dead. So he was disconnected from all machinery. He died at 9:30, and the parents came to the hospital at 10 o'clock to talk to the doctor, but they didn't know that the boy would be dead. So they couldn't even say goodbye to his boy. They couldn't consult. They couldn't take second opinions, even though they were collecting money to go to Professor Paul Byrne to get another opinion. So thank you anyway, Professor Byrne, for saving human lives. And I know that it's very difficult. I know that we are fighting against the mighty Goliath, but sooner or later, truth will prevail. Dear Szymon, we will always remember you and cherish you, and we will do all in our power to never let anything like that happen again. On the 3rd of December, there will be a court hearing against that hospital for not letting the parents even say goodbye to their boy. Thank you.
Thank you. And those of you who raise your hand, you can now take the floor. So first, Oskar Kaufmann, present here in the room. Thank you, Mr. Chair. Thank you very much to all of the speakers. To me, as a lawyer, this was very interesting, an area where I'm not an expert in medicine, so a group of distinguished experts. Thank you. I'd like to cast some light on the legal aspect to this discussion, because we are working on the presumed consent, presumed opposition, but the problem that we will have to face in the law in Poland is the matter of brain death. So that's why I wanted to explain the legal status in Poland, which is highly controversial, because according to Article 87.1 of the Polish Constitution, a source of the law in Poland is, of course, the Constitution, acts, international laws and regulations. But the criteria for determining brain death, the so-called brain death, are not a source of general law in Poland because they are determined in the regulation of the Minister of Health. And this regulation, even though it is of normative nature, it's published in the Journal of Laws, it's not a source of common law, commonly implemented law in Poland. So the criteria are developed in the following way. The Minister of Health, on a voluntary basis, selects a group of the so-called experts, and the criteria for selecting these people are only known to the Minister of Health, and this board then determines the guidelines. As the experts have said today, the criteria for brain death are highly controversial, and because we will have to deal with this problem from the point of view of the law, because the Act delegates this problem, it has to be it has to be solved sort of outside the jurisdiction. So maybe you would like to share an international practice with us and tell us whether the legislator or the law should describe in detail the criteria for determining brain death. Or maybe these criteria should be left to the experience, know-how, and above all, conscience of doctors. What's your take on this? Should we, to sum up the question, should we have a definition in the law with rigid criteria? If so, what criteria? Or should we leave these general clauses, keep only general clauses referring to knowledge, experience, and conscience of medical personnel? Thank you. Thank you. Anyone from our guests from abroad? Would you like to comment on this question by Oskar Kochman, Council?
Jeżeli nie, to może później.
Dr. Alan Schunman would like to comment.
Please.
I would answer that ideally, the law should not recognize brain death as death at all, but recognize the traditional criteria for death. But realistically, I don't think that such a law is going to be passed anytime soon. And therefore, I think the law ought to leave the criteria to the consensus of the medical profession, but giving patients and families the opportunity to opt out of any neurological criterion. I think that would be a realistic law.
Dziękuję.
Thank you. Christine.
Where's your question?
Just to add to that, again, I'd like to reiterate that even when you have consent, you have a problem because of the lack of information, as the doctors have pointed out. And if you look at a website online, it's actually on Facebook and also on change.org, The Right to Fight. And there you will see case after case after case after case of people who thought they'd consented and then realized, wait a minute, or they thought they revoked their consent, but it was not honored. And so consent is where the protection is, but in the end, they don't care if you've consented or not consented or what you've done, and the family is not respected. So my bottom line would be the family's wishes must have the last word. It's the only thing left.
Jeszcze, panie doktor Duyen.
And Dr. Nguyen wanted to take the floor. Doctor.
What we're dealing with is what we call the opt-in, which is informed consent, and the opt-out policy. I am so sorry to hear that Poland has gone to the opt-out policy. The opt-out policy is the policy of presumed consent, right? And at the bottom of everything, whether it's opt-in or opt-out, the public must be fully informed. All right. Now, I do not know how. I mean, in many of the opt-in country, like England, before England went to the opt-out, then the donor must say, "I want to donate," by carrying a donor card. And in America, is you have to check the checkbox organ donor on your driver license. The problem is, at least in America, when you go to the place where you get your driver license, you just have to fill in this questionnaire. Do you want to be an organ donor after death? Well, that's it. And we all think, the general public think of death in the common sense of the term, like the death of the cat, the death of the dog, and so on and so forth. They will have never thought that the organ are taken out from brain dead people. People may have heard about the word brain death, but they have never known what it actually is whatsoever, right? And so the first time that a person will come to know what brain death is when they have a family member being diagnosed brain death. And what they happen is they look at the person, the patient, connect to the ventilator, and they see that the patient is warm, you know, just like a living person, except that unresponsive. Right? Now, we cannot test for awareness. We cannot test for what we call consciousness. Consciousness has two levels. One is awareness, which is a first-person experience, and the other one is awake, you know, to be able to arouse. Well, the comatose person, is not arousable. So, but the brain death, the person declare brain death, the patient declare brain death, look like, for all the world, like somebody is alive, okay? For sure, if you look at the side of the bed, you look at the urine bag, urine is being made. There is nothing. I mean, there is no machine, there is, you know, whether ventilator or drugs that can make that can have that function to make urine or to make blood to circulate. All the ventilator does is to bring oxygen. Well, because, you know, it's what we call a prerequisite, right? So anyway, so you have to, the crux of the issue is public information. And because only then an informed consent is truly informed. And if people want to go to the presumed consent policy, that is an opt-out, at least the public also know an opt-out. Now, I was told that in Austria, my colleague said to me, you have to go onto the internet, you have to go online to this particular website, and it's very complicated. It's like navigating through a maze before you finally get to the menu where you can opt out. They make it very difficult for you to opt out. But nevertheless, people have to know what brain death is in order to opt in under the system of informed consent, or opt out under the system of presumed consent. So through education, not propaganda. If we go to in America, if you go to organ provider, what do you call, organ provider organization, OPOs, all you have is propagandas. You know, how the gift of life is charity and that kind of thing, but nothing about the truth concerning brain death.
Bardzo dziękuję, doktor.
Thank you, Dr. Nguyen, for these words. Someone else, I think, wanted to say something. Okay, Councillor Anna Kubala. Good evening to everyone. Can you hear me? Hopefully you can. Maybe you can speak closer to the microphone. Right, I'd like to use my computer at the same time, but I will just move things around so that I can speak closer to the microphone. Hopefully you can hear me better right now. Right, wonderful. Ladies and gentlemen, in Poland, as usually, unfortunately, we have absolute freedom for doctors to do as they wish. Unfortunately, they behave like bandits. organs are harvested from living persons, from living human beings, not dead bodies. They are living human beings. Most of the society, I would say 90% of the people, have absolutely no idea what's happening. People don't know that the person from whom organs are being harvested, is alive. There is a heart beating, blood is circulating, there are reflexes, responses, brain is functioning. People don't know that. I'm not going to talk about medical things, but people don't have any idea about it. And based on this lack of knowledge, based on this ignorance, they give their consent. And they say, physician's voice is the most important. What about our voice? It's our health, our life. Are doctors gods who will decide about us, about our life, our health? I think that's outrageous because it's taking advantage of our ignorance, of our lack of knowledge. So they are actually benefiting from our lack of knowledge. For example, our regulations on organ harvesting is Article 33 of the Medical Ethical Code, and also some articles from the Code on the Medical Profession. So those articles actually regulate everything. So just like it's been said before, the most important part, namely how to determine that someone is really dead, it's based on just someone's statement, someone's announcement. But an announcement, a statement, it's not legally binding. Just like with my colleague's organization, they actually went to the Constitutional Court, but they lost. This organization won because, for example, if the government introduces obligatory vaccination, they cannot do it through a regular ordinance. They need a higher level of legal act. So the Ombudsman for Human Rights has intervened. Actually, in 2015, there was a complaint filed with the Constitutional Court saying that certain ordinances are unconstitutional. But before there was a case, they changed the law. And now there is a new ordinance from 2019, but again, the Ombudsman intervened. Actually, this August, writing a letter to the Supreme Medical Board saying maybe it should be regulated in a better way, as a legal act, as a law, not an ordinance, not a statement that a minister can, issue and then withdraw and so on, and change it whenever they want, right? No one has control over this. Even members of parliament don't have control over this. But we elect members of parliament to make sure that all the important things are guaranteed at the level of law. And smaller details could be then included in regulations and ordinances. But the big things should be regulated at law level. But actually, the way it's done now, no one can control them. Whatever they do, they can do it freely. Not even senators, not even members of parliament can do anything about it. And there was another letter sent to the medical board or the medical professional self-government. But after that, all kinds of media smear campaigns were happening. And physicians or doctors will say, basically, I'm just giving you a recap, we're saying in all kinds of media outlets that they are doctors, they have the knowledge, and they should be the only ones to decide. So they want to decide about our life and death without hearing our voice. Someone was mentioning Teresa Jackowska, who told us in a different meeting that we were objects who had no voice. So same people over and over again are doing the same things. And doctors really got outraged and they started boycotting everyone who had a different opinion. So I don't know if the Ombudsman for Human Rights has done something already or not. Are they planning to protect us further or not? Are they going to go to the Constitutional Court to complain against that? Because, the announcement was just an ordinance. It wasn't a law, right? So it might have been not enough from the point of view of Constitution, from the point of view of our Constitution. But maybe the members of parliament from the Konfederacja party will do something about it. And well, let me just say that I want you to please educate yourselves on the topic. So that's a comment to all the Polish people present in the room, that we have created a special website where you can issue a statement that you explicitly don't agree to organ harvesting, because in Poland your family will not help you. They will not decide. They don't have a voice. In Poland we had a case of a person who, the wife of a man was asked for her to give consent so that her husband can be a donor. So a doctor took her 40 minutes trying to convince her to agree to donate her husband's organs. But fortunately, this gentleman in the end was operated on and he's now alive. But the doctor took quite a lot of time to try and convince her to do otherwise. So if there is haste, and if only doctors are to decide, that may not fully reflect the condition of the person, of the patient. Also, we heard about all the different medications that doctors give to patients so that they stymie all their reflexes to be able to convince everyone that they are dead. Okay, I think we need to finish our meeting slowly but surely. This room has been booked only till 9 p.m. our time, and still some people wanted to say something. I have a question to our experts, our remote speakers. What about the medical community, broadly speaking, because you meet at international conferences, right? So is there some sort of a consensus in the medical community to harmonize the death criteria? Because, the definition of death has been evolving and it can be different in different countries. The British criteria, the Harvard criteria, I think we are obliged by the British criteria. But the Harvard one, I think it's prevailing in Italy, in Germany, in the States. And the Harvard criterion says that brainstem death is just a prognosis, but not truly death. So have you come to a consensus as an international medical community? Because it seems like the medical community doesn't even speak in one voice. But we're talking about science here, right? Not art. So truth should be objective and clear and transparent. Professor Schumann wanted to say something.
Well taken. As I said in my talk, the only consensus is that brain death is death. But beyond that, there's no consensus on what brain death consists of, and there's no real consensus on how it should be diagnosed. There's not even a consensus on how to perform an apnea test. The criteria are different in the UK and the United States, for example. I don't know what they are in Poland. But when you get down to the details, there is no consensus.
Dziękuję. Teraz poproszę o głos pan Włodzimierz Skalik, poseł na Sejm. Bardzo proszę.
Pięknie kłaniam się, bardzo dziękuję za ten niezwykle wartościowy nasze spotkanie, bardzo wartościowe. Ono ma podwójny walor, bo po pierwsze w procesie legislacyjnym
in the legislative process, in the lawmaking process that we are preparing for, that we are drafting, we want to introduce a change from presumed consent to presumed lack of consent, opting out, which will change the situation drastically. So from presumed consent, we want to move away from presumed consent. In Poland, over the last decade, or in 2011, there were hundreds of transplantations, hundreds of transplants were performed, and even in the years 2020, 2021, there was a decrease in the number of such surgeries because during COVID, our medical services were blocked and many surgeries were stopped during COVID. And that's why in 2020, it was 1,080. In 21, it was 1,274. And currently in the media, from what we hear, transplantology is alive and kicking and actually growing. Last year, over 1,800 cases of such surgeries. So it's over 20% growth compared to the previous year. So it's a big increase. So it seems that this domain will be, well, will be growing and will have more and more advocates. So we have to take into account that it will be difficult for us to fight against it. But on the other hand, we are experts in fighting difficult battles. We are convinced and motivated to change the situation. I wanted to say thank you to the participants of this meeting, and also to our speakers. We are not medical doctors, we're not scientists, but you gave us a lot of knowledge. And the arguments that you've used, the examples that you've given, examples are always better than just dry lectures. We are very grateful for the knowledge that you've shared with us, and many, many useful arguments you've given us. It will be very useful to us in our lawmaking process. And also, it was very good to hear about medical self-government bodies, the so-called medical chambers. It's a difficult situation. I could say it's a pathology. I'm not a physician, but I have utmost respect to those noble doctors who work in Poland. I have a number of times been a member of meetings of those medical chambers, medical self-government bodies who actually instigated proceedings against very noble doctors. I went to a hearing or to a proceedings in Bydgoszcz where Dr. Radkowska was being evaluated, judged by those medical judges, so to speak. So in all those cases, actually lawyers who represented those doctors who were under attack used a very simple method to oppose. They said, or they were able to prove, that members of those panels of judges simply benefited from their collaboration with medical or pharmaceutical companies. In most cases, it was enough to show that those people should not be on a panel if they benefit from all kinds of companies, businesses. And they were recused. So basically, the Supreme Medical Chamber, which is this self-government, when they instigated proceedings against Dr. Sienkiewicz during one of the hearings, one of the judges on the panel, who was also a doctor, he said, "What do you expect? You will never find a case of a physician who is not sponsored by pharmaceutical companies." He said that during the break, that all doctors were sponsored. So this goes to show that this Supreme Medical Chamber, or the whole structure of those central and district and regional chamber, they are like mobsters. Those people, they don't represent patients. They don't represent the health services or the healthcare system. They represent a system that is funded by pharmaceutical companies. And they represent interests of global pharmaceutical companies. So we're dealing with a serious criminal structure that uses the state, that uses government structures and institutions that should be serving people to other purposes. And those structures serve someone else. And it seems that changing the law and moving away from presumed consent may not be enough. So we, as members of parliament, should aim further, and we should try to change the position and those medical chambers, their competences.
First and foremost, you need to eliminate the duty of being a member of this only structures, because each doctor has to be a member of such chambers, self-government. There should be a freedom to create chambers by doctors, and it seems that it's going to be a significant second step that will get rid of the pathology that we are talking about today. Thank you. Thank you. Professor Cicero also wanted to say something. Okay, Sao Paulo, Brazil, over to you.
Okay, I would like to say one last thing. I think that the apnea test is the Achilles heel of all brain death diagnostic protocols. You should fight for informed consent for the apnea test. That's all. Thank you.
Bardzo ważna uwaga, bardzo.
A very important comment. Thank you very much. Ladies and gentlemen, we're slowly wrapping up. The last two interventions. First, Agnieszka Kutyłowska, who has been waiting for a long time. And please make your interventions short. Hello, ladies and gentlemen. Well, we are pressed for time, so very briefly. I wanted to draw your attention to the fact that the issue of opposition, so opting out, is not sufficient, just opting out. For more than a dozen years or so, I've had these documents for myself and my family, and I understand that it's only a symbolic thing. Because, ladies and gentlemen, we have no impact on what the medical board decides. So once they decide that you are a corpse, it's irreversible. The patient has no right to treatment because he or she is not a patient. In Poland, there are some incidents where it's possible to save a human being, but as regards formal issues, they simply have the right to decide, and they won't let you go if they've decided. And we know on the example of Alfie and many other such cases, because this wasn't the only case. We had a Polish person 2 years later in UK, also a big movement in Poland to save this person. In the case of Alfie, you didn't mention, Madam, but it was a very important thing. Italy gave Alfie citizenship, and it didn't help, because all those bandits are holding us in a tight grip, using courts right now. So the judge issues a sentence, and that's it, no discussion. So we will arrive at this point in Poland as well. We also had such cases with vaccines, where a child and a mother were held hostage in a hospital, and Justyna could comment on it. They were held hostage under police surveillance in order to make sure the child does not avoid vaccination according to the will of the parents. So we are in the situation of terror that will tighten its grip on us, as is the case in the West. So courts are issuing decisions upon those poor people who need treatment. You simply issue a court decision or a court judgment. And I wanted to say something more, namely the issue of regulating opt-in or opt-out. Well, it's a marginal issue, because like I'm saying, we are in a trap. Even though I have the opt-out document, I'm not able to save my relative. I'm not able to make sure that he or she will be taken care of as a patient, because the sentence has been passed. So it's a very complicated matter, and you shouldn't only focus on consent to organ donation, because it doesn't deal with all of the problems. And one more comment. Ladies and gentlemen, we've heard about it today, and I'll sum it up. This is really barbarian approach. To me, it's a barbarian approach, cannibalism. I remember 10 years ago, there was a price on human being, and all his organs were worth $2 billion. So we hear now those altruistic arguments. We are forced to be altruistic, but on the other hand, there's hard business and not altruism. Heart transplant surgery in the United States costs more than $1.5 million. Where is this money going? Who's earning the money? Because someone's earning this money. We are donors. We're supposed to be altruists. But on the other side, there is no altruism. There's simply hard business. And so each part of our body, even our skin, our tendons, have a price. It's not just the heart or our kidneys, really. So parts of our eyes, tendons. So we are really facing a terrible business, horrific business. I don't know about the law in the countries of experts who are participating in this meeting. But as regards Poland, it will not do if we just switched opt-in to opt-out, if we switch from presumed consent to presumed opposition. Thank you. Thank you very much. Objection, sorry, presumed objection. And the last voice, Agnieszka Piwar, and we'll be wrapping up. Thank you so much for your invitation. Can you hear me? Yes, we can hear you. Well, you've mentioned lack of knowledge on several occasions. The Chancellor talked about it. And indeed, lack of knowledge is huge. And I didn't realize it 10 years ago that transplantology is related to the fact that you kill people. And I found out about it from Father Norkowski, who's present with us online. Father Norkowski gave me an interview. I published the interview, and then I kept publishing articles about it. And my acquaintances who got the link from me said they never realized. And not long ago, I published another article about it, and I received a lot of feedback, a lot of emails. People said they never knew about it. So there's a huge propaganda about it, films, series, showing transplantology as something positive, as saving life. They show a person whose life is saved, like a figure, and viewers identify with this figure. This is a nice, warm figure. And this is how you talk to Poles that transplantology is something that's great because it saves life. And one more thing that came to my mind. When I first published the article about it 10 years ago, when I published the interview, a woman wrote a comment under one of my articles saying that she was terrified. She said she had a heart transplant and that this heart was transplanted into her. And she was terrified because she found out from the article that thanks to the fact that she's alive, someone else was killed. And she said, how am I supposed to live knowing this? And I was terrified when I read it because I realized that because of the article that she read, now she's terrified. So you have to think about the people who are the recipients because they don't know about it, and once they find out, it will be really hard for them. Thank you so much, Madam Agnieszka Piwar, our journalist, who honored us with her presence. Ladies and gentlemen, we've had so much content. We've discussed so many things, and it's a lot of food for thought. And I encourage you to take advantage of the materials. I can't give the floor to anyone else anymore, but I'd like to thank above all our experts from abroad, and our experts were Dr. Doyen Nguyen, Professor Alan Schumann, Dr. Paul Byrne, and Professor Cicero Coimbra. And above all, thank you, Father Jacek Norkowski, Doctor. It is thanks to him that we were able to invite all those distinguished guests, experts, and we were able to listen to what they have to say. Thank you very much also to those of you who came to the building of the Parliament, the same, and everyone watching us online. So I am closing the third meeting of the parliamentary team for Health and Life on Poles, and I invite you to other sessions as well. Good night.
Thank you very much for your participation in this event. I'm happy to see you, all of you here.
Thanks a lot. Thanks a lot. Many thanks. Have a nice evening. God bless you.
And thank you for
Good to see you also, Father, and also Alan and Cicero, and also Doyen. Nice to see all of you.
Bye-bye. I have to go right now. Okay.
Okay. Ciao.
Ciao.
Thanks a lot.
Thank you, Cicero. Thank you, Alan, that you find time for that such important meeting for us here in Poland.
Of course. My pleasure. Okay. Bye.
So bye. It was long. Dziękuję bardzo, pani doktor.
Stay in touch, Father.
Yes, we should.
It's really important. It's much simpler now than it used to be because of the focus on creation. And at creation, there's a unity of the body and soul. And life is a continuum until the event of death. Death is when the soul separates from the body, and it's manifest as destruction, first as autonomy.